Good morning.
Good morning. Good morning, everyone.
Good morning.
Good morning.
Good morning, folks. We'll give people another probably 2 minutes or so to join. Welcome, folks, for giving people about another minute to join before we get started. Welcome. We're giving folks just another 30 seconds or so to join. Okay, let's go ahead and get started. For those who don't know me, my name is Kathy Coring Del Rio. I use she, her pronouns, and I'm with Maine Equal Justice. I also chair the Maine Care Advisory Committee. We usually get started with a quick round of introductions, quickish round of introductions. We will start with, I'll read the list of folks from the MAC list and then alternates. And then we'll jump over to folks from Maine Care and then come back, catch any MAC members that we missed. And folks who are guests will then have a chance to introduce themselves. If you're here as a guest, you can also introduce yourself in the chat. So if you could introduce yourself with your name, your pronouns, and what brings you here today, if it's an organization or another affiliation. And we'll start with Miriam Bashir. Ines El Harbi. Norma Desjardins.
Dr. Desjardins is not here, but my name is Julie Tucci, she, her, and I'm representing St. Apollonia Dental in her behalf.
Thank you. And hopefully it's not too bad, but I apologize. There's some yard work happening across the street, so that's kind of noisy, so sorry about that. Catherine Brandt.
Hi there, I'm Catherine Brent. I'm the chair of primary care at University of New England College of Osteopathic Medicine and an officer with the Maine Osteopathic Association. And it's with that hat that I'm attending this meeting.
Thank you. Jessica Drenning.
Hi, good morning. Jessica Drenning. I'm the Senior Maine Care Program Manager, she, her pronouns, with the Office for Family Independence. Sorry. Thanks.
Jamie Bork. Or Eric Fromberg. Nilsa Ayanle. Mallory Shaughnessy. Or Suzanne Farley. Kathy Dion.
Good morning. My name is Kathy Dion, the Executive Director for the Autism Society of Maine, and I'm also the parent of a consumer, and I use she, her.
Thank you. Becca Matasovich.
I think Becca isn't here yet, but I am an alternate until she gets here. Kaylee Hess, she, her pronouns, Children's Oral Health Network of Maine.
Vicki McCarty. Rachel Collmore.
Good morning, everybody. Rachel Collmore, she, her, hers, Consumers for Affordable Healthcare.
Sarah Squires.
Good morning, Sarah Squires, she, her pronouns, Public Policy Director for Disability Rights Maine.
Gia Drew,
Good morning, everybody. Gia Drew, Executive Director at Equality Maine, she, her pronouns.
Susan White,
Good morning, Susan White, she, her pronouns. I'm representing the Maine Home Care and Hospice Alliance.
Catherine Hamilton, Leo Delicata,
Good morning. Leo Delicata, he, him, legal services for Maine Elders.
Sarah Lewis, Laura Cordes,
Good morning, Laura Cordes. I'm the Executive Director of the Maine Association for Community Service Providers, MAXPE. I use she, her pronouns.
Rachel Dyer, or Nancy Cronin.
Hi, it's Rachel. I'm with Maine Developmental Disability Council, and I use she, her pronouns, and I'm delighted to be working outside today.
That's lovely. David Winslow,
Good morning, David Winslow with the Maine Hospital Association.
Ann Sedlak,
Hi all, I'm the Director of Advocacy at the Maine Medical Association.
Bobby Martin, or Hannah Hudson.
Hey, Kathy. Yeah, Bobby's unable to join today. Hannah Hudson, she, her pronouns, Policy Director at the Maine Primary Care Association.
Candy Henderly, Teresa Cochran,
Good morning, Teresa Cochran, Senior Director for the Center for Healing and Recovery for Wabanaki, and I use she, her, hers pronouns. Thank you.
Great, thank you all. So now we'll pass it over to the Office of Maine Care Services, and I'm just gonna pass it to you, Molly Slotsnik, because I see you.
Sure. Good morning, everyone. Molly Slotsnik, Chief Operating Officer for the Office of Maine Care Services, she, her, hers. And I will go to Lisa.
Good morning, Lisa Weaver. I am with Office of Maine Care Services Policy Unit, and she, her, hers.
Lisa, we can't see you. Your video is on Jessica. Actually, sorry, so there's Lisa, and let me also take the opportunity to introduce our new Director of Policy, Jessica Miller, and now you can see her on Lisa Weaver's box. So Lisa's name, but it's Jessica. Jessica joined us yesterday, so she is on day 2, and this is her first MAC meeting, and moved here from Massachusetts, so is also new to Maine, as well as Maine Care. So we welcome Jessica, and also big thanks, grateful to Kristen Merrill, who has been in the acting policy director position since August of last year. And so that has been a lot of work, and we're very grateful to Kristen for having taken that on. So welcome to Jessica. I'm sure many of you will get to meet her. And so I'll just go to you, Jessica, and you can say hi.
Hi, nice to meet everybody. And I'm happy to be here. And I'm she, her pronouns. Thank you.
And Kristen, why don't we go to you next, and then you can pass it on.
Sure. Thanks, Molly. And thanks for your kind words. I appreciate it. I'm Kristen Merrill. I am the State Plan and Policy Development Manager for the Office of Maine Care Services, and I use she, her pronouns, and I will pass it over to Mandy.
Thanks, Kristen. Amanda Lee, Rate Setting Coordinator for OMS. I use she, her pronouns, and I will pass it to Sarah Fisher.
Good morning, everyone. My name is Sarah Fisher. I use she, her pronouns, and I'm the Maine Care Outreach Specialist for OMS. I'll pass it to Sana.
Good morning, everybody. I'm the Member Engagement Manager at the Office of Maine Care Services, and my name is Sana Osman. Kayla.
Hi, everyone. Kayla Sargent, Director of Strategic Planning and Communications here at the Office of Maine Care, and I use she, her pronouns. And I don't see anyone else from Maine Care. Are we missing anyone from Maine Care?
I see Becky.
Oh, Becky.
I am. Hi, I'm Becky Parsons. I'm the EPSTD Coordinator with Policy.
Great, thank you. Welcome all. I did want to go back and if there's anyone who is a MAC member who we missed in the first round of introductions, can you go ahead and take yourself off mute and introduce yourself?
Hi, this is Mallory Shaughnessy, current vice chair of the MAC and chair of the provider subcommittee. I use she, her pronouns.
Thanks, Mallory. And Lisa, I'm just flagging that a few other folks introduced themselves in chat, and I think I saw at least one MAC member.
Thank you.
Anyone who is a guest who would like to introduce themselves, you can do it in chat or you can take yourself off mute. Okay, so then let's go ahead and get started with our agenda. First up, we are connecting with Office of Family Independence, Ian Yaffe, who, Ian, you didn't get a chance to introduce yourself yet, and Jessica Drenning about the continued unwinding, and if there's any other OFI updates you'd like to share.
Sure. Well, good morning. I'm Ian Yaffe, he, him pronouns, Director of OFI here at DHHS. This is my first meeting back from parental leave, so getting caught up. So thanks for your patience. I can do sort of a quick unwinding update, and I'll post the link in the chat for the dashboard. I'm happy to pull that up if helpful. Let me put that in the chat here. So our dashboard is actually updated through the end of April, which I wasn't sure about, but you know how you now have sort of our complete unwinding data in here since unwinding began through April 2024. So the first year or first 12 months. We have not in terms of percentages, there hasn't been that many changes, but there are now approximately 57,000 people who are pending overdue renewal. So those are the folks that will be scheduling into August, September, and October. No, that's really like about where we expected it to be. But we'll probably have a more substantive reflection on this over the summer and some updates as we get closer to that August period of time. In terms of how we'll be processing renewals, that will stay the same until we get to those August renewals. So there still will be renewals due in June. There won't be, for people who don't return, there's the potential that people successfully renewed and then they will be due for another renewal in June, for example. If they don't respond to the June renewal, they still won't be closed in June. They'll be rescheduled into August, September, or October once we can get the individual level passive renewal process implemented. So there are some people who are going to go through the renewal process twice under this process. And just wanted to give a heads up for that. But happy to answer any questions that you have about unwinding. Otherwise, not much changing on our end. Otherwise, then looking forward to the August through October cycle when we'll really be looking for some support with outreach to members and making sure that people understand that this is really the time period now where if there's no response, that people will be closed. So that's the outcome that we've been sort of preparing for, and just wanted to give the preview that we're still on that track and no changes in the past month other than that there's some new data updates, and those are available on our website.
Thank you, Ian. Any questions? I did also want to just note that there were some changes to the MSP program in the budget that passed, and I I know there's folks on this call who have questions about that, but given that Ian is just back and also that so much of the legislative session has still been moving, I was going to suggest that we get updates on that process for June, if that makes sense, Ian, unless there's anything you do want to share.
Yeah, I mean, we've already, so I think folks are maybe familiar with overall what happened in the budget process. I'm happy to provide an update on that. But or maybe I'll just do that quickly because it's not particularly complicated. So as folks may be aware, the administration proposed a partial implementation of the Medicare Savings Program expansion during the supplemental budget process. That was changed during the debate on the budget by the legislature. So the supplemental budget as enacted retains the MSP expansion that was in place in last year's legislation in the last session. So essentially the big highlight of that is expanding the qualified Medicare beneficiaries program, or QMB or QMB, to 185% of FPLs of the FPL, federal poverty level. And then the qualified individual program, or QI, would expand to 250% FPL, and the specialized low income Medicare beneficiary, or SLIMB, that program would essentially become absorbed by QMB. So there would really be, after July 1st, there would be 2 Medicare savings programs in Maine that people can enroll in: QMB for people up to 185% FPL, and QI for 185% or 186. I'm not sure where the exact cutoff is there, but up to 250 that people can enroll in. So we are on track to implement those changes by July 1st. And so in June, we definitely can have a better update about implementation and transition for current members and all the questions that you might have. But otherwise, I think the major question that I think you have of, are we going to do this by July 1st? The current plan is to deploy those updates by July 1st. I don't know. So we have to do tech changes to make this happen. And then we also have to do rulemaking and a state plan amendment. So we will do, I'm not sure exactly what order those are going to be in. Some of them may be retroactive, but the plan is still to implement by July 1st. So by the June meeting, we'll have a more substantive update there. But I hope that that answers at least the majority of questions. I'm happy to collect questions now to come back with if there are any. And I know that many people on this call have been particularly active in the conversations here, and that you've been curious about where this is going to go for a long time. So thank you for your patience and for the work that you're doing to both help with outreach here and advocate around policy.
Thanks so much, Ian. That's really helpful and definitely answers most of my questions. Does anyone else have any others that they'd like to share for Ian to bring back in June? And then just a flag, we talked about this at the last meeting, but there had been some ongoing questions about the CHIP rulemaking, which I believe we said at the last meeting there would be an update in June. So hopefully that can happen then too.
Yeah, I haven't checked that I assume, Jess, that rulemaking isn't out, right?
Right.
Okay. Yeah, so I don't know. I mean, I think the next update is for that rulemaking to come out. So hopefully by June, we never really have an exact, we never really have a way to preview when are the rules going to be proposed. but they are being we are working on them right now, and there was legislation that we needed that has been enacted for us to be able to move those forward.
Great. Thank you, Ian. And Jessica, were you trying to jump in to say something?
No, just can confirm that's where it's being.
Great. Thank you. That's helpful too. Any other questions for OFI folks? All right, thank you. Then let's move on to the communications updates, and I'll pass it over to Kayla and Sanaa.
Thanks, Kathy. I am pleased to share that we have a couple of updates within communications today that will be delivered by our communications team. So Sanaa, we'll start with you with updates on the access rule.
Hi again, and I have a few slides I want to share. So I'll discuss the access rule. Recently, it has been adopted by CMS. So the proposed rule by CMS, which is the Centers for Medicare and Medicaid Services, and that is the federal agencies that oversees Medicaid, Medicare, CHIP, and also the marketplace, or the federally facilitated marketplace, or Obamacare. Has really issued a rule back in May of 2023 and asked the states to comment on this rule. And recently they have adopted it and released the final one in April of 22nd. And the rule covered the Medical Advisory Committee, which is the MAC, and the Beneficiary Advisory Council, the BAC, and also home and community-based services and fee-for-services payment. And today I'll talk to you about the MAC and the BAC updates. As far as that, I'm going to start with the name change, because both of the names were slightly changed. The actual name with CMS was MCAC, which is Medical Care Advisory Committee, and it was changed to Medical Advisory Committee. We say MaineCare, but it's still the MAC. Beneficiary Advisory Council was when they first proposed the rule, it was a Beneficiary Advisory Group, and they've received a lot of comments against the acronym, which was the BAG, and so now they've changed it to the Beneficiary Advisory Council. I have a link here for the access rule, for the full access rule. It's about 1,000 pages if anybody's interested in some reading. The part about the MAC actually starts from page 27 to page 50 if you want to read the whole part. And also I have the rule for the fact sheet. I have the fact sheet too in here, and then we can drop them in the chat later on. Okay. So as far as the MAC and the changes required right now, we are required to have a minimum of 25% of in the MAC to be individuals with lived Medicaid experience. And that is done gradually. So 10% by July of 2025 and 20% by July of 2026. And after that, we're supposed to have 20% of MAC members to be members from the BAC. And the MAC and the BAC are each only required to meet once per quarter. And also representative from the state agencies who sit on the MAC will not be voting members. If there's any voting that's going on in the MAC, they're not supposed to be voting. The activities should be publicly available on the website, which we're currently doing. We should have the bylaws up, and also the meeting schedules, agenda, minutes, membership lists, and we currently have that on our webpage. At least 2 MAC meetings per year should be open to the public. And these meetings should include public comment period, and that we should give about a minimum of 30 days notice to people to join and give comment. And we should create and publicly post an annual report summarizing the MAC and the BAC activities. And the first report is actually due on July 9th of 2026. As far as changes for the BAC, so the BAC members, as I said, should be from diverse backgrounds. This is something we're currently working on, and we're looking into having people from different backgrounds and looking at the different populations. The BAC members must be selected by the state on a rotating and continuous basis, and the terms they serve would be 2 to 6 years. So we're looking into having members join and have different terms so we don't lose the whole group. And it will be between 2 to 6 years terms. And we're thinking about having the group be of 12 to about 15 people. They should be current or previous members or individuals with direct experience supporting members, and they could be paid support or unpaid. So they could be family members, or also somebody who's being paid to support members. And as far as what we're doing, we're currently working on updating the plan we have, and so we can start working according to the final rule released. And that's all I have for you today. Thank you.
Thank you. And I just wanted to mention, related to this, we had talked this is on the agenda later, but we can talk about it right now, is that we had talked previously about trying to get our plan for strategic planning for the MAC going after legislative session. Well, they did adjourn a couple weeks ago. The session isn't quite done. Some of us are going to be there today, and there's also a veto day on Friday. So we aren't quite there, but I'm planning to have this be a bigger topic at the June meeting, and we can talk as we're working on the strategic planning process about how the strategic plan intersects with these rule changes that affect the function of the MAC as well. Any questions for Sanaa? Okay, Kayla, is there more updates?
Yes, we have one more exciting update. Sarah Fisher is going to share a little bit about the culmination of over a year's worth of effort on her part to create a mini docu-series portraying some of our main care members in an authentic and genuine way. So I'm very excited she's going to share one of those videos with you today. Sarah, I'll hand it over to you.
Thanks, Kayla. Hi, everyone. Again, Sarah Fisher. I'm the main care outreach specialist. My title changed a couple months ago, so I'm still getting used to the new title here for main care. And as Kayla said, I'm excited to share the result of our project that we've been working on around kind of documenting some experiences for members that members have had with main care when thinking about kind of our outreach plan overall for main care. Having people know about main care and how to apply and how to access services is, of course, extremely important. But we also wanted to tackle kind of the trickier to tackle area around stigma of main care and just overall being able to relate to other people who have main care, hear other people's stories, in the hopes that people watching this may be able to be like, oh, that person's story reminds me of my family, or just helps break down those barriers for people who may not want government insurance or working with the government to get healthcare. So about a year and a half ago, worked with a vendor, and also Rachel Collmore from CAIC was a really important partner on this. So thank you, Rachel, for all your assistance and guidance on this project to create a documentary series. So we have 3 videos. I'll share one of them today, and the other 2 are posted on our YouTube channel, or the OMS YouTube page, and we are hoping to continue this project in years to come. We are going out, getting a new vendor in the next, going up, sorry, Kayla, we are working on working on more videos moving forward. So I will share this first video here. I think I have to share my sound, right, Kathy?
I think so.
Yep. Let's see. I can't hear that. Can you?
We could, Sarah. It was good.
Okay, great. I can't. That's interesting.
I feel like after everything I've been through over the past few years, our story kind of makes us who we are. They say it takes a village, and I definitely have that village. I grew up in Lewiston, downtown. I've been here all my life, 31 years. Besides a short time I lived in Lisbon. I learned how to do things on my own really, really young. I was a very prideful person in working and being the best and being at the top. I was always taught college, make your money, and then start your family. We talked about children, but not like right away. I wasn't feeling so well, so I had stopped taking my normal medications. After starting to feel a little better off the medications, within 2 weeks I started not feeling so well again, and come to find out I was pregnant. You plan to have a birth plan, and they say that your birth plan never goes as planned. And my birth plan went completely south. My kidneys were failing, and they took me into an emergency C-section. I was very scared. My husband wasn't sure that I was going to make it, so he stood there. He watched. He pretty much watched his wife pass away. At the same time, he was taking on his daughter. But she's here and I'm here. One-handed? Come on! But I definitely panicked. I could hardly even pay for myself at that time because I didn't have employment because of everything that I was going through. I've always worked hard, and it was the first time that I ever needed something from somebody else. Affording healthcare is challenging. It's so expensive. It's like the price of a car payment. And that car payment is like a month of food for us. I actually learned about MaineCare and was recommended by my mother-in-law. Without her, then I may not have ever signed up, honestly, because I was a very prideful person. I needed a reality that my life was falling apart pretty much. My mother-in-law told me, like, what are you going to do next? How are you gonna eat today? And how are you gonna buy pull-ups? How are you gonna buy more formula for your child? I had to set my pride aside and say, okay, I need to look for other ways to support myself. So I was like, all right, I'll give it a look. Then I started to receive information in the mail, and I started to actually read it, and I started to understand what it really was for. It's all about helping you. And now this side? It definitely supported me through my pregnancy and the complications with that. It has supported me with all of the health things that Maddie has had to have, especially with her autism. I love you. I love you. You're beautiful. You're beautiful. Thank you, baby. Maddie is wonderful. She's so sweet. She's so kind. She's so loving. Is it Colby? Yeah. She's definitely got a little sass. What are you doing? Without MaineCare, Maddie would not be at her peak where she is now. With everything she's done from pre-K to speech to OT, she wouldn't be as successful with friends and communication.
Yeah, let's go check it out.
Without MaineCare, I wouldn't be able to have everything that I currently have because it provided us a cushion to be able to provide for our family and hopefully continue to provide and move forward with our lives.
Wait, what?
It's been a long road. We're not rich, but we're not poor. We're comfortable. And we're loving, and that's all I want my daughter to see. I had no idea what my life was gonna look like. My life was at a standstill to the point where I had no idea to look left, right, up, or down. You have to keep trying, and that's kind of how you make a path in life. It brings you on another path and another journey, and that's kind of what happened with us. I had no idea what to do. I was fallen, and somehow a path became available and a door opened, and we were able to be where we are today.
Great. So that's Laura. As I said, we're really thrilled with the video and are excited, as I mentioned, to hopefully make more moving forward. So if anyone has any thoughts or ideas, please feel free to share. We would love to have anyone's thoughts or ideas on other kind of stories or people's experiences to tell. So thank you so much.
Thanks, Sarah. Other Sarah?
Yeah, I was just wondering, that was a great video. Are there plans to add closed captions to those to make them accessible?
That's a great question, Sarah. I will make a note of that. We absolutely should add closed captions. And I think because they're on our YouTube page, I believe you can add those. I wasn't sharing off of our YouTube page though, but I will make a note of that.
Yeah, I mean, the YouTube will automatically generate them. I would just make sure that the generated ones are accurate, because they're not always, they get a little creative.
Great, thank you.
I will add to that quickly too. We haven't fully finalized the plan for how we're going to disseminate these videos and all of the different places we could use them. Social media is definitely on our mind, and of course our website. We welcome ideas from folks on different ways we can get those videos out to the community, and also considerations for accessibility that we may not have encountered before. So thank you for bringing that up, Sarah, and welcome the group to reach out to either Sarah Fisher or myself if you have additional recommendations for us.
Appreciation for the video in the chat, and also just naming a suggestion to feature a Katie Beckett related story.
That is high on our list. So thank you for the suggestion, Jillian.
Any questions or other thoughts for the communications folks?
I have a thought. I'm wondering about adding a story specifically about someone who hasn't had dental care their whole life, since people that just sense there is a benefit now. Just explaining that could be really useful, and the ties to overall health.
That's a great idea. Making note of that now. Thank you.
Great. Well, thank you for sharing that. Up next is updates from MaineCare, and also welcoming Michelle Probert is now here with us. Michelle, do you want to introduce yourself and then do those updates?
Sure. Thanks, Kathy. Good morning, everyone. My name is Michelle Probert. I'm the director for MaineCare. I use she, her pronouns. Nice to see everybody this morning. And I've had the opportunity to see that video a few times now, and it still makes me choke up when I see it. So thanks for watching it with us, and we welcome your suggestions and look forward to having more of them representing different folks who benefit from MaineCare. So thanks. I have a few different updates, tough act to follow, I will say. first, Kathy noted that just as a reminder, the legislature is not actually completely out of session yet. Today, they're actually running the appropriations table. We don't actually anticipate that there will be much impact to MaineCare today, but you never really know what's going to happen until it's already happened. So we will see. And then again, there's will be veto day. And again, there's always the opportunity that unanticipated things could happen or anticipated, and we won't really know anything for certain until the legislature is adjourned. And as a reminder, it was not a bipartisan budget, and so that means that it will be 90 days from when the legislature adjourns until the budget is actually effective. I know that there have been questions regarding the cost of living adjustments for sections 2 and 26 and any behavioral health services that did pass in the budget. That was for an COLA effective date of January of 2024. We will not be able to go live with those COLA adjustments until the budget is effective, but when we do go live, those adjustments will be retroactive back to January. And we are meeting with different folks within MaineCare internally to be able to share guidance on how to make the transition and the billing and adjustments as easy as we can, taking into consideration burden for providers as well as process and burden on the MaineCare side. So more to come on the logistics, but we're actively talking through that. Questions on that update? All right, so I did also want to share an update on the Change Healthcare cybersecurity issue. Since get my notes in front of me so it doesn't look like I'm talking off to the side. Since we last spoke, we were able to restore claims processing. That happened on March 27th. In the first week, we processed 440,000 claims, which is more claims than we have MaineCare members. So that will give you an idea of the volume that was pent up. We started processing claims, but then it took a bit longer until we were actually able to get the payments out to the pharmacies, which happened on April 10th. We are monitoring the volume of those claims, and we're still not quite back to normal levels yet. So there are pharmacies that are still kind of processing their backlog of claims, but we are getting close, we think. Just for awareness, for any members who paid cash for claims during the outage, they should work directly with their pharmacy in order to receive a refund. If you come across members who are experiencing problems or pushback with this, please reach out to the pharmacy help desk. I can't remember if we talked about this at the last MAC, but I think Maine is the only state that used Change Healthcare specifically to, I'm probably not going to say this in exactly the right way, but basically share information with CMS regarding members who qualify for the limited income subsidy, members who are dually eligible for Medicaid and Medicare. And so with the disruption to that file, which again, was not an issue for any other states, so it took us a little bit longer to realize what was happening. There were certain individuals, dually eligible individuals, who were being charged more than they should have when they went to the pharmacy. For example, they might have been told they had to pay a deductible because the pharmacy didn't have their updated information that they should be eligible for a limited income subsidy and therefore should just have a copay. So the pharmacy help desk was working with a lot of those members. We sent out member communications. The good news is that the file process has been restored, and so it should not be an issue any longer. And the proper cost sharing is now in place for those members. Let's see. Also, just for awareness, even though we're processing claims again and we're issuing payments and things are much better than they were for a while, the full pharmacy system has still not been restored. For example, we are not yet able to update drug pricing that comes through. We still cannot process prior authorizations. So we are continuing to waive prior authorization requirements. And we are working actively and meeting, I think, weekly to see what steps have been achieved to get us towards restoration of the full system, but it's going to take a while because this is a complex national issue that we're still working through. I also did want to share that there's so many layers of companies, but United Healthcare, I think, is in charge of Optum, which is in charge of Change Healthcare, but they did acknowledge within the past few weeks that they did confirm that there was protected health information that was inappropriately shared during the cyber attack. They really were not able to share any additional detail as to how much data or for whom or for what kind of payers, or did it include Medicaid? It's really, we don't really know more. We don't know more than that, period. Having said that, United Healthcare has made available a service for credit report monitoring and identity protection for anyone who calls. So you don't have to prove that you were impacted by the breach because frankly, they don't know who was impacted by the breach. So if somebody is concerned about the topic, then they are able to call and take advantage of those services. And we do have communications with all the links to that as well. So that's the pharmacy update.
Michelle?
Yeah.
Can I ask a quick question about that? Thinking about people who maybe, I know you've been communicating with members about what was happening and what to do. Do you all have thoughts about having some simple information we could share in social media about if folks had to pay for medicines and now need to get a refund at the pharmacy, or I'm wondering if there's ways that some of us who work with members might be able to be helpful in getting information out to people.
Yeah, I think you could coordinate with Kayla and her team, and we could share kind of the high level messaging that we have, and collaborate on how we could adapt that for use potentially.
Great, thank you.
I also wanted to share that separate from pharmacy, but still related to Change Healthcare, we are caught up on the backlog that we experienced with, because Change Healthcare was also in charge of our mailroom. And so any claims that came in paper or fax documentation, et cetera, was backlogged for a while. And we are now collectively caught up on that backlog. We continue to make progress and are over the worst of it. All right, my last update I wanted to share is about the service provider tax. So as a reminder, not this immediate legislative session that is closing up, but the previous legislative session, there was legislation that passed that effectively repeals the service provider tax for main care providers who are subject to the tax. We, as this group, have discussed previously that the general practice at main care has been to build the cost of the tax into reimbursement rates for services that are subject to the tax. And so with the repeal of the tax, there will be a corresponding rate reduction since providers no longer need to pay that tax. That is the high level. Like everything, it of course gets a little bit more complicated when you delve into some of the details. So as I think everybody knows, we've been doing a lot of work to update our reimbursement amounts, as well as having well-documented reimbursement models where it's clear what all the assumptions are in the rates. We have still not reached a point though where we have great documentation for all of our rates. And so, as we discussed a year ago, the department made the decision that we are only going to be adjusting rates and backing the service provider tax out where we have solid documentation, clear documentation that the service provider tax is documented in the rate. So, and you know, some reasons why this happens is it could have been documented in there initially, but then there was legislation to change the rate in this way or in that way. And, you know, years later, it's kind of like, you could have a whole debate about whether it's in there or it's not in there. And so, so for things where it's really fuzzy, we're focusing on rates where we have clear documentation that the service provider tax is in there, and those are the rates that we will be adjusting. I know that there is a desire for us to share the list of specific codes by section of policy. We are working on that. When we were first looking at codes and fiscal impact, we had assumptions about where we may be for certain rate determinations, where if we were updating the rates, then this would no longer be an issue. But some of those timelines have changed. And so because of those changed timelines and the fact that the service provider tax is being repealed January 1, we're just going back through that list to update where there are and are not impacts. Prior to sharing actual codes though, I did just want to remind folks of the kinds of services that are subject to the service provider tax. This is in Title 36, Chapter 358 of Maine statute. And sometimes, and CMS actually does this, but people may refer to this as the PNMI tax. That is misleading. It is true that PNMIs are all subject to the tax, but it is not only PNMIs. So the services that are listed as being subject to the tax are providers of, yes, PNMI services, also community supports for persons with mental health diagnoses, also community supports for persons with intellectual disability or autism, home support services for persons with intellectual disability or autism, group residential services for persons with brain injury. So those are the categories of service subject to the service provider tax. There are some exemptions. Schools are exempt and hospitals are exempt. And so some of you may recall that when we updated our Section 28 behavioral health rates, we actually, which was in January of 2023, we actually created a separate number of rates specifically for schools who are providing the service. And for those rates, we did not add the service provider tax in because schools who are actually the providers, again, do not have to pay the tax. All right, I will pause there. Again, we are working on coming up with a list of codes, but I did want to set kind of the baseline of the process and the kinds of services that are subject today as a start. Any questions?
I may not fully understand this, so this question may not make sense, but based on a question someone else was asking me about this, I believe there were funds included in the biennial budget to help address some of the rate, like making sure that there weren't negative impacts for providers who were already struggling with rates. Is that true? Or is there, I guess I understand you're only gonna, it would only affect the rates if there's clear documentation that this is something in the rates, but this question specifically came from folks with nursing homes, and was curious, like, when will providers understand if there will be a negative impact for them?
So first I'll say that what you're saying does not sound familiar to me. I have not been aware of any funds appropriated related to repeal of the service provider tax to go towards certain providers. So I will say that. Again, and this, you know, if, for example, if somebody has not been paying the tax, then, so I'll say it a different way. As long as individuals or providers who are subject to the tax have been paying the tax, this should be cost neutral, right? Because they're no longer going to have to pay the tax. Their rates will be proportionately lower, but they no longer have to pay the tax, and so it should come out even. I will say that, again, there are some services where we don't have clear documentation, and so for a provider of a service where we didn't have the clear documentation and the rate, so we're not reducing the rate, this will feel like a benefit because they're not going to have to pay the tax if they've been paying the tax, and the rate will not go down. And so somebody could argue that that may not be fair, but you know, we had lots of discussions about this, and we didn't feel it was appropriate to do kind of a blanket 6% reduction off all rates when there's not like a clear history and track record for all of the services involved.
That's helpful. Thank you. Mallory?
Thanks. So just a question. So in January of 25, the SPT, the service provider tax, will come off the rates. The rates will be adjusted downward to eliminate that, but there'll also be a COLA that should be a new COLA applying that January. So will all of that work be done and the new rate at one time so that there's not like a bunch of switching again happening? So it's like the service provider tax will come up and the COLA will go on.
I'm hedging a little bit because that is what I would like to happen, but I want to make sure that have conversations with the team to make sure that we're ready to make that happen, because I fully agree that it would make sense to adjust for the COLA and the reduction at the same time, so we're not talking about multiple adjustments at different times. So I will follow up on that front. Mallory, thank you. That's a good question.
Thank you. That would be very helpful.
Laura?
Thank you. Good morning, Michelle, and thank you for that update, and thank you for being so deliberative and thoughtful about assessing all of those rates and where there is a history and not just doing a blanket 6% reduction. My question is really about timing. I know those you're working to come up with that list of codes for folks, which would be helpful for, you know, for, I can imagine one or two services where people have been paying and people haven't been paying, and you know, it'll be a pain point, but knowing that earlier in the process to see if there's any other histories that people can come up with to advocating for change one way or the other, you know, would certainly be helpful. And so, you know, are you thinking sometime this summer, or is it early fall for that list of codes?
I would like to confirm the list of codes this summer, if possible.
Okay, that's terrific. Thank you.
There was something else that I wanted to say and I lost it again. It may come back to me. Any other questions?
I don't see any.
All right, if I remember my point, I will put it in the chat, but thank you.
Thanks, Michelle. Okay, so next up are provider updates. And one thing I just want to note is that we had as a standing agenda item updates on the provider enrollment challenges, but I think it sounds like things are going much better there. So we probably will take that off as a standing agenda item going forward. Kayla, did you want to share anything more about that today?
I can give a quick overview that I got from Bill Logan about our current standing. So Bill says that we've maintained a steady case inventory in the mid to low 500s over the past 4 to 6 weeks. Our average turnaround time has significantly decreased. As of April, we were looking at 16.1 days, and the current average age of case in inventory is 18 days. And we will be following up with another e-message update in the next week or so. So that will come through our e-bulletins page.
Great, thank you so much, Kayla. And I think if there are issues that people are concerned about, they could bring them to the provider subcommittee. And then if there were a situation again where things become more widespread or serious, like they were earlier in the year, then we could bring it back to the full MAC.
Thanks, Kathy.
Thank you. Mallory, do you want to share updates from the subcommittee?
Sure, thanks. So the MAC Provider Subcommittee met April 24th, and our next meeting is May 29th for anyone who wants to join. The Zoom is in the notes that should be part of your package that you received for the meeting today. We discussed the Evergreen main care issues that had been percolating and happening. And apparently the issues with the 17 versus 15 characters has been resolved, but there's still the differential with Evergreen having a 50% rounding rule built into their system, and main care's 80% rounding rule that differs from sort of the national average, I guess, according to Evergreen. But and the administrative burden that that is placing on providers trying to retool things to make that match up. And we are hoping to have some more information on that at the next provider subcommittee meeting in May this month. Catherine Coolidge came and presented information about the code request form and issues that they're seeing with that when it's submitted. On the notes, there's a couple of key issues that are often, or spaces on that form that are often left blank by providers that need to be filled out more fully. You can take a look at that in the notes. And we discussed e-signature requirements, and we are looking, MaineCare is going to compile sort of a key communications and policy documents into a summary so that we can share that because there's still some questions around what is and isn't okay with the e-signatures with some of the changes that have happened over the last few years. We had requested an update on the service provider tax. Thank you very much, Michelle, for that. That was very helpful. And know that we're looking forward to those specific sections coming, and codes, which will be really helpful. We are looking at having a joint committee meeting with the rates subcommittee at some point. And if anybody's interested in that, they can reach out to either Laura or I. Regarding alternative payment models and discussion and question and answer around that. I think that's about it from the provider subcommittee for this past month. And again, we meet again May 29th. And the only other update I have is that I am retiring in June and we need a new MAC provider subcommittee chair to take this forward. June will be my the May meeting. Actually, I won't be available in June, but the May meeting will be my last meeting. So we need a new chair for any provider association folks that are on here that are interested. Please speak up and let Kathy or whoever know.
Yeah, you can let me know, but also Mallory, do you want to say a few words about like what being chair of that subcommittee entails?
Oh, sure. So we've sort of got a system going now. It was, pulling it together and creating it after a while. But basically we meet the last Wednesday of the month at 4 p.m. for an hour. Try to get out. I work with Sana and others and Shannon at Main Care office, try to put together an agenda the week before and get that out to the list of folks interested. And, you know, try to gather those agenda items prior to the week before so that Main Care has time to get somebody at the meeting if they are needed there for question and answers or explanations or presentations. So that's pretty much it. And then I submit those notes, take the notes, submit them, and they get posted on the website. So really, it's just a once a month meeting and then prepping the agenda and doing the notes.
Thanks, Mallory. That's really helpful.
Yep.
So if you are interested in that role, please do let me know as soon as possible so we can get you connected with Mallory before she retires. And echoing others, saying congratulations on that, Mallory. And hopefully can have things continue on without interruption. Any questions? Okay, great, thank you. Next up is rate system reform updates. Amanda, do you want to share anything? I did share a link to the April update that you provided.
I don't have any updates at this time, but I can post that in the chat as well.
Great,
if people
thank you so
haven't seen
much.
it yet. You're welcome.
And Laura, do you have any other updates you want to share from that subcommittee?
Oh, sure. We last met April 22nd, and I will put in the chat our next meeting. We generally meet the last Monday of the month, but that is in May, the Memorial Day. So we're actually having two meetings in June, June 3rd and June 24th. We're always happy when Amanda is at our meeting. So we did get an update from Amanda. We talked a little bit about, you know, the what we've all noted as it's not quite the end of the legislative session, but we thought at the time we had a good handle on things that had passed through the budget anyway. $30 million in the Main Care Stabilization Fund, the dollars for the COLA. Thanks again, Michelle, for the update on getting a notice about how folks can go back and retroactively attain those funds. It sounds like 90 days or so from now, but to know how we're going to do that was also, again, a topic of discussion at our meeting. So hearing from the department on guidance over the next month would be, certainly help prepare folks to get those funds. It sounds like sometime in August. We continue to talk about topics that we wanted to explore with, inviting the department in to talk more about the rate determination process and maybe looking at some way of opening up for evaluation, knowing that we're 2+ years into it and coming up on another legislative session. If there's any changes that we'd like to make or recommend from the subcommittee and the MAC to the department to make in the process. As Mallory mentioned, we would like to do a joint meeting, open to all, but for both subcommittees to explore with the department and hear about more about current alternative payment models and what the future holds in terms of the department's plans. I think that is everything. Meetings are open to everyone, and we hope to see you in June. Thank you.
Thank you. Any questions? I just want to lift up what Michelle shared in the chat, that there's a caveat around the COLA implementation, which is that will happen as soon as practicable following the effective date of the budget, given that there are lots of different processes within the state that can't always be instantaneous.
Kathy, may I say one more thing that we talked about? And, I'll make a request to Jessica and Michelle the idea that, after the veto session, we also talked about, there might be bills that we hadn't identified that have made their way through, or efforts that would change up the rate determination calendar as we know it, and or system as we know it. And we would welcome the department to come into a future meeting to share kind of their update on things that impacted, good, bad, and otherwise the rate determination process. Thanks.
Thanks, Laura. That's helpful. All right, next up then is the dental subcommittee, and I will do that this month. It's a pretty quick update. I wanted to note that the rate redetermination process has been happening for Section 25, which is the section that covers dental, and folks were submitting comments last week. I think Friday was the deadline around that. And we are in the process of trying to find a new standing meeting date and time, and the delay around that is really my fault. But I yesterday sent out a poll for members of that subcommittee to try to find a date that works so that Courtney Plaston will be able to attend those meetings. And if you are part of that committee and for some reason didn't get that message, please let me know and I'll make sure you get it. You can just send me an email or send me a message in chat. And then if you are not part of the dental subcommittee but would like to be, please do reach out to me and I'll get you added to that list and let you know when we have our new date and time. And then I also did just want to remind folks, because we had a bunch of people, not a bunch, but some people missing last month, that last month's MAC meeting materials included links and attachments related to a presentation that multiple members of the dental subcommittee did to the Health and Human Services Committee at the legislature about sort of the state of oral health and access in Maine. So if you're interested in those issues, that might be something you'd like to take a look at. If for some reason you don't have that and you want me to resend them, please let me know. I'm happy to do that. That wasn't technically the subcommittee that was presenting, but the Health and Human Services Committee asked multiple people who also happened to be members of that subcommittee to present. So there was a lot of overlap there. Is there anyone from the dental subcommittee who wants to add anything to that? Are there any questions? Okay, so then we're going to move on to the rulemaking packet, and Kristen Merrill has kindly said that she'll continue to do that this month since it's just Jessica's second day. So Kristen.
Can folks hear me? Okay,
Yes.
sorry. Having issues unmuting there for a moment. Thanks, Kathy. Yeah, we do have a few updates this month. We do have a few rules that are currently still in pre-review status with either folks internally within the Office of MaineCare Services or with our Attorney General's office. And that includes chapters 2 and 3 for section 20, which is our home and community-based services waiver for adults with other related conditions. We also have our section 31 FQHC, federally qualified health center rule, and section 43 hospice services, which I think some folks might remember was just recently adopted, but as a result of some legislation that just passed in this session, that has gone back out to rulemaking to remove the previously implemented EVV or electronic visit verification requirements. And then the other section of policy that's currently in pre-review is our section 92 behavioral health homes rule. We did adopt a couple of sections since our last meeting. Our chapter 3, section 29, which is support services for adults with intellectual disabilities and autism spectrum disorder. We did file our final adoption packet. Folks probably remember last month, we did talk about how that was under review with the legislature because this is a major substantive rule. And so that was filed April 30th. And so folks will see that finally adopted the end of May. We also adopted our Section 94, which is our EPSDT policy. It's early periodic screening, diagnosis, and treatment. We filed that rule with the Secretary of State's office in mid-April, and it went effective April 22nd. And we do currently still have our Section 23 developmental and behavioral health clinic services in active rulemaking. And for some awareness, I know folks have mentioned a little bit about items in the budget related to rate reform. Either myself or Jessica will be able to provide more information next month, but we do have in the pipeline right now rules being drafted that are slated to be filed as emergency rules, again, specific to rate reform efforts. And that includes our Section 25 dental services, Section 45 hospital services, and Section 67 nursing facility services. I think those are the big updates from OMS policy. Anybody have any questions? Okay, thanks.
Thanks, Kristen. So as we wrap up, I did just want to reemphasize that Mallory is retiring and she is also the vice chair of the MAC. And so if there is someone who is a current member of the MAC who would be interested in that role, please let me know. And the vice chair can be any member of the MAC. You don't have to fill a specific role. And also, mostly, your role is mostly to help out in case I can't be here or if I weren't able to prepare an agenda or something like that. So it's not a huge lift, but it is a really important lift when needed. So please do consider doing that and let me know if you're interested. If we have, I think we technically vote for the vice chair, so we'll do that regardless. But if we have multiple people, then we'll make sure people have information about those folks before the vote. Michelle?
Thanks, Kathy. I was just going to ask, can people nominate people who they think might be a good fit for the role?
Oh, sure. Yeah. I think if people want,
people might not volunteer, but then if they get nominated, they're like, oh.
yeah, I think that that's a good idea too. And actually, we hadn't done it the last election because we had people who had volunteered, but I think a couple of elections ago, we did have some nominees. So yes, please do. If there's someone you're like, they would be great, you can nominate them.
And I can tell you, as having been vice chair for, I don't know, 2 years now, I've only had to step in and do the committee, I think once or twice. So it's a real easy lift.
Thanks, Mallory. And then other things, one thing I wanted to, this is not on the agenda, but I realized it this morning, is I wanted to touch base. We don't have to make a decision necessarily today, although we have time, so maybe we can make a decision today. But July 2nd is our July meeting date for the MAC. And in the last several years, we've handled the July meeting a couple different ways. Often there's a lot of people out that week because of the holiday later in the week. So we could reschedule to the next week if that time works for the main care staff who'd have to participate. That's one option. We also have a couple of years just canceled the July meeting and waited till August for the summer MAC meeting. So that's another possibility. And I know I didn't put this on the agenda, but was curious if folks had thoughts about that date and what your preferences would be. I'm slightly inclined to canceling the July meeting and giving folks a break for a month, unless it feels urgent. I know there will be some like implementation dates that happen in July. But it feels like we can get updates about those.
I would be good with canceling July. I think it's hard. People have so many vacation times, so I would be all right with canceling going to August.
I see some head nodding. I see some comments in the chat that agree as well. Is there anyone who feels strongly that there's a reason not to cancel in July? Okay. I'm gonna go then with canceling July this year. And you all can get a nice, hopefully beautiful summer day back. And Lisa, if you could help with making that happen with the calendar invite, that would be great. So we'll meet in June and then we'll meet again in August. And then the other thing I just wanted to flag is some of the potential topics for the June meeting that came up today or have come up in a previous meeting. It sounds like there's some interest in checking in about any law changes that will be impacted, will impact MaineCare, figuring out, if there's updates around laws that passed, that would be helpful. We should check in about that in June. It feels like we will need to hopefully have a vice chair election in June. I will give an update around strategic planning and what that process will look like to start to get feedback from you all about that. And potentially there might be an update about the rates that are impacted by the service provider tax change, but that might not be ready by June, it sounds like. So I'll make a note of it and touch base with MaineCare in advance of scheduling that meeting. Is there anything else that I missed that folks had as a topic that came up today? Okay. And I think then that is it. We have our next meeting in June on June 4th. And in the meantime, I hope you all have a wonderful day.
Thanks, everyone.
Bye all.
Thank you.